Dr. James Hebert, Professor of Epidemiology from the University of South Carolina in Columbia, discusses his article appearing in the June 2013 issue of Mayo Clinic Proceedings.
I would like to talk about our article, which we're publishing in the Mayo Clinic Proceedings, entitled Scientific Decision-Making, Policy Decisions, and the Obesity Epidemic. I think, as everybody knows, we have a serious problem with obesity in this country, and it's becoming a problem all around the world. And this article really focuses on the wrong way that we've envisioned the problem and therefore gone about solving it. First of all, we make really clear that obesity, as described by body mass index, that is the total size of the body, may not be the right way to think about this. And if you consider NFL football players, many of them are quite large, but they don't have much adipose tissue or fat tissue in their body. So that's one of the important issues that we discuss. Another one has to do with equating the problem with the physical attribute. That is, we know that in order for people to gain weight, there has to be an imbalance between the energy they consume and the energy they expend. But this is really quite simple, very simple-minded. The reality is that people compensate. Even very obese people, even people who are gaining moderately large amounts of weight over moderate periods of time, tend to be in really good weight regulation. This raises some really important issues about measurement. So one of the shortcomings that we observe is the inability to measure the risk factors properly, that is, measure what goes into people's mouths and how they move their bodies, in relation to how we design studies. The obesity epidemic is a serious concern. It's a serious public health concern. It's a serious concern for personal health, and it's certainly a serious strain on the medical care delivery system. The resources that are being applied to solve the problem, though large in scale, are used very inefficiently, and part of the problem has to do with the fact that we just haven't conceptualized what's going on really well. We haven't designed studies properly, and we haven't measured things very well. Given the scale of the problem and the misery that is currently causing people and will cause both individuals and the healthcare delivery system in the future, we really need to take a step back and say, how to conceptualize this problem better, and how to take that conceptualization and use it in combination with the wonderful developments that have happened in biomedicine and epidemiology and public health research over the past 50 years in order to come up with a solution that is commensurate with the scale of the problem. And this article challenges us all to do just that.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.